Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 873rd episode. Let's have the headlines of the day. A study reveals that 13.4 million infants born prematurely in 2020 and cause preterm complications, which are a leading cause of under 5 years of age mortality. According to WHO, three-quarters of these deaths could be prevented through the implementation of existing affordable interventions. Researchers at the University of Miami reported on Thursday that first two confirmed cases in which SARS-CoV-19 virus crossed a mother's placenta and caused brain damage in the baby. Harvard-led study uncovers genetic markers for preeclampsia and gestational hypertension, offering predictive risk assessment and insights into pregnancy disorders. In a recent study published in the Nutrients Journal, researchers revealed a positive influence of structured Mediterranean diet intervention on the anxiety and stress levels, mindfulness, sleep, and quality of life of a pregnant woman during her pregnancy. Now let's go to the topic of the day. We will be talking about pre-pregnancy counseling and how important it is, because अगर हम pregnancy plan करने के पहले हमारे youngsters अपने बारे में कुछ जान लें, अपने lifestyle के बारे में, अपने कुछ blood test करा लें, उनके genetic उनका क्या मेकअप है, क्या उनके अंदर बॉडी में क्या चीजें हैं, वो सब पता कर लें, तो बहुत सारी बातें जो अभी हमने सुनी जो न्यूबॉर्न बच्चों में होती हैं वो प्रिवेंट की जाती हैं। इसके बारे में आज हमें बताने के लिए आई हैं डॉक्टर सिंथिया एलेक्जेंडर। डॉक्टर सिंथिया एलेक्जेंडर, वेलकम मैम। She
Yes.
is a highly accomplished consultant at Padma Clinic and Nursing Home, dedicated to provide exceptional medical care and guidance to her patients. Formerly serving as the director of the Institute of Obstetrics and Gynecology in Chennai, her vast experience and leadership have contributed significantly to the healthcare community. Dr. Alexander has received numerous accolades for her outstanding contributions to the medical field. Her exceptional achievements have been recognized with a prestigious Lifetime Achievement Award, solidifying her position as a distinguished healthcare professional. Welcome, ma'am, again. And today, let us talk about how we go about pre-pregnancy counseling. So, to begin with, I want you to tell our viewers why pre-pregnancy counseling is important.
So thank you very much, Dr. Anita, for this opportunity of talking, and to all the viewers, and for the person who arranged this also, I'm very grateful. So today's topic is on pre-pregnancy counseling, or we say preconceptional counseling. Now the grand marriage takes place, and then afterwards the couple are by themselves. So it is very important that we remember a line I always say, as we sow, so shall we reap. So it is very important that our youngsters, as they are preparing for their marriage, it is very important that they must be aware of life beyond the marriage celebrations. So actually, I am a resource person for premarital classes. So I have been taking these classes for many years, and I have found as a retrospective, many of them come to me and tell you, whatever you said, madam, stood us in good stead, and it has really helped us. So this pre-pregnancy, or as we say, preconceptional counseling is very important. Now, why is it very important? Because the baby which is born should be a healthy baby. And a healthy baby brings joy, happiness to the family, to the parents, to the family. And it is a gift to the society, to the country. So it is very important that all our youngsters, that they should be aware of this pre-pregnancy counseling. Now, what is this? That actually, this pre-pregnancy counseling important because in 2006, the Center for Disease Control and Prevention defines the preconceptional counseling as a set of interventions that aim to identify and modify certain things in the girl. That is the biomedical, in the couple actually, the biomedical and social and behavioral of women's health, and so that we can prevent and manage certain problems during the course of pregnancy. Now, it is like an education to the couple to increase their knowledge and the attitude towards the pregnancy. So, it helps women to enter into pregnancy with optimal good health to reduce the risks indicated by the, and in case they had a previous problem, it will help to reduce the oncoming problem in this pregnancy. And so the benefits are both maternal and the perinatal outcome will be bettered. And especially in certain cases where there is unplanned pregnancy, it is very important we see the ill effects of this unplanned pregnancy. Because it is said that by the time, if they don't have any pre-pregnancy counseling, and by the time they go for the first checkup, they do a urine test or a beta HCG test, and by the time the pregnancy is confirmed, it is almost 6 weeks. And by 6 weeks, the brain is half grown, the heart is formed well, and things like that. So, in case there is a deficiency, and this will lead to problems. So, prior to them becoming pregnant, it is very important that all young couples should have pre-pregnancy counseling. Now, take for example, what are the things that we have to do in it? So, it is not only giving them the medical aspects, but as such, we counsel them. So, the couple will come to the doctor and we have a talk. You spare them the time and you give them a talk. You say you're embarking, you're planning your pregnancy, you're embarking on a very good mission in life. Your future generation is to come coming on, and you have to take all the care. So psychologically, we have to give them the support. We'll have to tell them. Some girls are still scared in pregnancy. Will this happen? Will I go through pregnancy safely? So many things. But we'll have to tell them nothing to worry. It is one of the beautiful occasions after marriage, and it is important. And it is also important that we tell them, don't postpone your pregnancy. That is my personal thing. I always tell them, once you get married, have your first baby. There is a famous saying, no, the test of the pudding is in eating. Unless you become pregnant, where is the guarantee that you'll become pregnant? So I tell them, and that too, I always say, in your newly married status, with all your love and affection towards each other, the product will be even better. So I always tell them, go through your first pregnancy as early as possible. Now, what are all the precautions that we have to, or tests that we have to do before they embark, especially like certain medical disorders? Now, we have overtaken China in becoming the capital, diabetic capital of the world. So it is very important that we must take it as an important step to see that the onset of diabetes is controlled in our country. Now, for this medical disorder, especially about diabetes, it is very important that, especially if there is a family history of diabetes in the mother or the father, and also if the girl is obese or she's above 35, it is very important that her status, her glycemic status should be checked. So we say her hemoglobin A1C should be preferably between 5.1 to 5.5. And we say her fasting blood sugar also should be below 110. And once she becomes pregnant, according to the DIPSI thing, we say her fasting blood sugar should be less than 90. So they must undertake a blood test to make sure that they have no hyperglycemic, they are not in the hyperglycemic status. Now, some may be already a diabetic. So definitely they have to check with a diabetologist, make sure that the blood sugar levels are low so that they are fit for conception. So similarly, like epilepsy. certain girls may be epileptic, so they may be on certain drugs. So it is very important that they must get their counseling from their medical professional to find out whether they can, once they become pregnant, what are the drugs they can continue and what are the drugs that they should avoid. Like that, there are many these problems in the history of the medical history where people should take care. So now coming to this pre-pregnancy counseling, we always say immunization also is very important. We must make sure that they have had the rubella vaccine, they have had that hepatitis B vaccine, and we explain that in case a person contracts rubella in pregnancy, the baby can have some deleterious effects. Same way, if they are hepatitis B, and the mother is hepatitis B, and she goes through pregnancy, she can have a lot of problems. The mother, maternal problems can be very severe, leading to maternal mortality. So, for want of certain small precautions like that, we can't afford to lose a mother. So, like this, certain immunizations should be done prior to them planning their pregnancy. And similarly, we always advise before, once they became pregnant, we we advised them to take folic acid. But now we say, even before, as you are planning your pregnancy, you must take your folic acid so that your serum folate level is adequate so that your baby's brain development is fine. Because as I said, by the time you go for your first consultation, it's almost 6 weeks and the baby's brain would have half developed. So we don't want anybody with a low serum folate level to have to go through, start their pregnancy. So that is why there are some companies, actually some medical companies, market 100 tablets, saying, and they say you can give this when you go for the wedding, give the couple this packet
Yes.
of 100 so that you start early taking your folic acid. And we have to explain to our patients that folic acid is only part of the B complex and there is no problem in taking this. Like that, a little heart to heart talk will go a long way in encouraging our patients. And then similarly, they must check their hemoglobin status, because if a lady with an anemia, she's anemic, and if her hemoglobin is 10 and below, she may have certain problems. She may have a threatened abortion or a complete abortion, and intrauterine growth restricted baby can be there, or a preterm delivery. And stunted growth is one of the causes for anemia. And on record, it is said that India has 7% of the world's stunted growth people. So it is important that her hemoglobin status also is assessed so that she is smooth. And it's very difficult for the mother also. She may be running out of breath, all these things. And at the time of delivery, we must tell the normal loss of blood is about 500 ml in a cesarean. It is. So unless your hemoglobin status is adequate, you can pass through the period of pregnancy in a very comfortable manner. So hemoglobin. Same way the diabetic, as I said, sir. So all these things should be spoken to the couple, and thing. And why I said the couple, because it is better now that we call both the husband and wife, so that when we hear, nowadays we hear of some domestic violence, domestic abuse. So when you call the husband and talk to him, he also shares this responsibility of pregnancy. So we tell them, so if she's vomiting, it is a normal thing. So you must have certain amount of empathy towards your wife. Oh, she's vomiting, she's not able. So why not I make a cup of coffee today, or make some juice for her, so that you educate the husband also. So that way it really helps. I've seen in my personal practice. So that is why I said we must call the couple. And maybe another sitting, the in-laws, the mother-in-law or the mother, the family can be included, so that everybody joins in rejoicing this pregnancy and helping her to tide over small things like hyperemesis and certain discomfort, all this. And if she's a working lady, nowadays, of course, many people come and ask, can we work from home? So if it is possible, they can even work at home. But the only thing is, we must tell them for that every 50 minutes that you sit, you just take a walk for another 3 or 5 minutes, so that you don't have edema in the legs. And it is pregnancy is a hypercoagulable state, so you should walk a little like that. And many people ask about exercise before pregnancy. So I'd say you do your routine exercise. Once you become pregnant, you need not exert yourself much, but you can continue your walking and your mild physical exercises. So that is one thing. Many people think once they become pregnant, will it be a strain on the pregnancy if I do continue the exercise? So it is the reassurance that we give to our patients like this. So it is a very wonderful talk I have seen, because when they, as I said, embarking on a mission of pregnancy, they feel very comfortable psychologically. And also, we tell them that the doctors are there to look after you, the sonologist is there, the diabetologist. So it's a combination of everybody who will give you the current statistics of how your baby is growing when they go to a sonologist. And then when they go to then later on, the pediatrician is there. All that you can tell them that our pediatrician is there. She'll take care of your baby. So you give them a comfortable thing, so that now most of the, sometimes what happens, this unplanned pregnancy, which I was just telling, that usually happens when the educated level is little low. Some low education level is there, or when they are very young, teenage pregnancy. So they don't have the means to have this pre-pregnancy counseling, and so some of them will lose out on it. So, but anyway, at least you catch them in the early months of pregnancy. So, according to Dipsy, now we say there is a line: you focus on the fetus for the future. So this should start as early as in the preconceptional stage itself, so that especially when, because of, as I said, this pandemic, like which is coming on this of this diabetes in pregnancy, or a diabetic becoming pregnant. In both ways, it is very important that this transgenerational shift of this hyperglycemia should not go to the baby, so that it doesn't become a diabetic in its lifetime. So this pre-pregnancy counseling is very important, especially to prevent the future of diabetes in our country, so that we will not have the pride of saying we have overtaken China. No, not that way, like that. So all these things I thought I must tell about this. And as I said, the empathetic part of it, tutoring the husband to look after. And of course, now even the government is very kind to give 45 days earlier leave, like that. So all these things have really made pregnancy a very comfortable journey for the young girls nowadays. And about 35 years and above, they must go for certain screening, because more chances of problems can come when the ovary is aging, and also the other medical disorders that may set in if a lady above 35 conceives. So she regarding hypertension, or if she's already a hypertensive, it can be aggravated in pregnancy. So all these things pre-pregnancy itself, if they control the diet, exercise, lifestyle modifications, it will help this lady to sail through pregnancy very comfortably. That I thought I must tell. If there are any questions also, I am willing
Yes.
to.
Yes, ma'am. There are
Yeah,
certain questions our
yeah,
viewers want to know, especially amongst the North Indians.
yeah.
Thalassemia is a very common problem,
That's what.
and many patients are found to be
Uh,
thalassemia
uh,
carriers.
uh,
So,
so this
should we do a screening for thalassemia
screening, I
before
always
pregnancy?
believe, because it's more common. Thalassemia is more common in the Mediterranean countries and Southeast Asian countries also. Beta thalassemia should be screened. So it is better. After all, it's only a blood test. So it's better,
Yes.
so that the patient should feel comfortable. Later on, that regret should not be there. I should have seen this and all that. So it is better that there is a screening for thalassemia done pre-pregnancy, like that. And
And
like
yes, ma'am.
Yes, sir. Any other question
Yes,
also?
ma'am.
I will.
Yeah.
Uh,
Okay. What about
and
knowing the blood group of the parents,
Yeah.
to be parents?
Uh, yeah. So both the parents' blood group should be done on RH typing, so that in case the mother is an RH negative and the husband is RH positive, accordingly we can do the Coombs test during pregnancy and anticipate. And also, I always believe that, especially if it's the lady is negative, it is always better that during pregnancy or at the time of labor, it is a delivery, it is always better that there's a standby of blood available for the mother also, I always say. So that earlier itself, if they know their blood group, RH typing, certain things can be prepared, and we can prevent certain catastrophes during delivery or postpartum period, like that. Similarly, now about diet, many people will ask, what should we eat? I mean, pre-pregnancy, you have your routine diet. Cut down on fatty foods, anything which can lead to obesity and the liver. I mean, where the liver is not being loaded. So that we tell them, you take a routine meal. And for this folic acid also, I think certain products are available now in the market where it is fortified with folic acid, wheat flour, like that. Some flour which we are using for chapati and all that is fortified with folic acid. So it in that way it helps the lady. And diet also, we say green leafy vegetables, all that. About eating, some people have a little thing about eating non-vegetarian food, especially deep sea food. They say that deep sea food has certain problems like that. So, as far as possible, you can avoid the deep seafood if it is possible. Fresh food which is available will be a better option rather than taking frozen food which is sold in the markets, like that. Uh, then,
Uh,
similarly, uh, yes, madam.
yes, no, I'm waiting for you.
I don't know. That's why I said. Then same way, certain chronic diseases, especially the elderly age group above 35, there can be hypertension, some renal diseases, and thyroid also has to be checked. Now, normally in pregnancy, we say the thyroid level should be 2.5. So if they have already been on tablets, thyroid tablets, it is better that they check their thyroid level, thyroid profile before planning their pregnancy, so that the level is maintained well even once they become pregnant, like that. Then
So,
otherwise, I
what about women who smoke? The
ah,
to be
now
mother, if she's a
yeah.
smoker.
Now, I think culture is changing. Now I see many young ladies having a good time, good company, and they are smoking, having alcohol, and maybe those who are not able to have this high profile life are having some other drugs also. So it is that point also we must stress, because alcohol, tobacco, all this is definitely injurious for the baby. It may lead to an abortion, maybe leading to preterm delivery, or if the baby continues, it may go in for intrauterine growth restriction, because there may be placental problems. And one more thing, actually, June 5th is World Environment Day. I always think it is our duty to teach our our young generation, those who are coming to us for counseling, that at my age, I might have lived in a green, lovely earth. So you may keep money, deposit money, wealth, everything for your children. But you must also see that in your life, you leave a green earth for your future generations. So, this is the best time to talk to them about saving the planet and saving the environment. So, you must tell them it's not the number of candles that you cut on your baby's birthday, but the number of trees that you have planted. And of course, all this disposable plastics and things like that. So that definitely you will be leaving not only a legacy of a clean earth for your children. So this is the best time to talk to them to plan their future. It's not only the bank account or the property that they leave, but you can always tell them that this is also very important. So I hope on June 5th, which is World Environment Day, many people start planting trees. So making more oxygen available and making the green earth better. Right.
Very nice message. Must agree. But there is a question that you tell the women not to smoke if they are planning a pregnancy. But
Yeah,
what about if the husband is a chain
husband.
smoker
So
and
this
he
passive
smokes in the
smoking.
house? Yeah.
So that is why when you talk to a couple about pre-pregnancy counseling, it is better that we call the husband also. So I always say, education is not only the IQ, the intelligent quotient alone, knowing about pregnancy and how we are planning all that, but it is also the EQ, the emotional quotient. So the husband must think, if I smoke, she will inhale these fumes and my baby will also suffer. So it is important that we stress. Suppose I'm asking the couple, do you smoke? If the lady says, no, doctor, I don't smoke. So I must give a smile at the husband just to find out if he is also smoking. Suppose he says, no, I don't smoke, fine. But in case he confesses that I smoke, I will have to tell them, of course, somehow you were lucky, you've got, you're going to have a baby soon. But we must stress on the infertility point also about nicotine, hazards of nicotine, and then tell them once your lady, your wife becomes pregnant, she becomes a passive smoker. So this will affect the baby, the placenta, and there can be retardation of the growth of the baby, which will not yield a good baby. So if we advise them that way, they can think. And I think even this high Wi-Fi usage and too much of viewing, I think we should slowly teach our youngsters that slowly, maybe at a particular time you watch and then put it off, but not have sleepless nights, because sleep is also very important. Right.
And another question that they have asked is, what about weight problem? Certain
Um,
people have less weight and most people have more weight.
More
So
weight.
what do you
Uh,
advise to them before
so,
conception?
suppose a lady before pregnancy she's underweight. It is very important that we assess her hemoglobin status and her diabetic status. And if it is only that she has been lean all through, we should insist that she takes a little high protein diet and make sure that she has good nutrition so that she can carry her baby safely. The obese people who are heavyweight must be told of the medical problems that can set in. Now, and also obesity can have certain problems during delivery. So that if we just mention about that and about the diet, that normally you take so much of calories in a non-pregnant stage. Then in pregnancy, you must take this much, a little plus 500 or so. Like that, if we teach them the calorie intake and what type of food to avoid maida. I tell my patients to avoid maida, to avoid sugar, to avoid added salt and dairy products, and have your plate with lot of vegetables and a rice at little at the end. So I'll always say all the white things may look nice, but if you avoid all the white things, it will go a long way for your health and for your baby's health also, like that. Just to talk to them in a friendly way. This
Yes.
is my 52nd
Very.
year as a practicing doctor, but I
Oh
love my
my God.
profession.
Seems like it the way you have been explaining so nicely. So, to end today, I would like to know how to take care of the workplace stress and the family stress by the woman who's planning a pregnancy. Should she look
Now,
into it or no?
yeah, definitely. Then the workplace, she must plan it in such a way that in case her work hours are very heavy, she can opt, maybe payment wise, she may lose out if she cuts her hours of work. But it's always better that we take care of our health and the baby's health rather than the money making. So in that way, now suppose 12 hours of sitting, or if it's night shifts like that, they must opt for a a more comfortable job at the office. Same way at home, of course, doing physical work, routine house work is not a problem. They can. But how far, suppose she has to run the whole, it's a big family, and she alone has to stand and cook and all, then that is why I thought the other members of the family also should be called in and explained that she has to take rest. She can't be standing for so many hours in the kitchen, and heavy lifting of a say heavy bucket full of washed clothes and going up to the terrace to dry those clothes, like that. A little talk with the other members of the family will definitely help, like that.
Thank you. It was a very detailed description of how one should go about before planning a pregnancy.
um,
So, thank you, Dr. Hi, you'd like to say something, ma'am?
and many girls will say before becoming pregnant, during the when they are with their husband, they'll say we have lot of white discharge. So white discharge in married women can be not only because of some cross infection from the husband. In that case, you treat her, do a smear on treat her, but sometimes bacterial vaginosis can occur. So you can treat them, give them a course of probiotics and thing, because I found if this bacterial vaginosis continues, the chances of preterm labor is there. So it is better to treat them so that, and support them when they say it is white, that they have white discharge, and ask them if it is itching, if it is yellow thing. All this part of thing also to be taken care of, like that.
Right. Thank you, ma'am. Thank
Yes,
you
ma'am.
so much for joining us today. Could you show us the certificate, please?
Oh my God.
This is a small
Oh, that's
token of respect, ma'am. And it has been really nice, Dr. Alexander, talking to you today. We will
thank you
meet
so
again for
much.
another topic which is close to your heart. And that will be all for today. Dr. KK Med Talks will be back tomorrow at
Okay.
7:30 with another show, edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you, madam, so much. I enjoyed it. Okay.
Thank you. Same here.